Hi, welcome to this short video explaining a little bit about the profession of physiotherapy and why you should come and study physiotherapy at Stellenbosch University. I am Marianne Unger. I am an associate professor in the Division of Physiotherapy at Stellenbosch University. I chair the undergraduate program and am also responsible for curriculum development and innovation, making sure that the program is relevant, up-to-date, and evidence-informed. Physiotherapy in South Africa is an internationally recognized qualification. South Africa, through the Society of Physiotherapy, belongs to an international organization, World Physiotherapy. And the benefit of that is that even though you graduated in South Africa, your qualification will be recognized anywhere in the world. A little bit, what is physiotherapy? Physiotherapy, the philosophy that underpins everything that we do in physio, is not just rehab after an injury or disease, but we see the ability to do what you want to do when you want to do it as the heart of what it means to be healthy. So physiotherapy really aims to promote normal development, promote the ability to do what you want to do when you want to do it. We are involved in maintaining body systems and functions. And also, obviously, if you've had an injury or a disease, our aim is to restore maximum movement and function. We work, therefore, in all spheres of healthcare, namely that of health promotion, prevention, but of course, our core business is treatment, intervention, and rehabilitation. So the aims of physio, just to repeat what I've already said, we restore, we reduce the impact of dysfunction, and we try to enhance function and therefore improve performance. Physiotherapy is very broad. We literally cover all aspects of the human body, but it is typically divided into three sections, namely orthopedics. We like to call it neuromusculoskeletal physiotherapy. We also involved in cardiopulmonary conditions, heart and lungs, and another large area of physiotherapy practice is neurology. So I'll briefly talk to each three. Orthopedics, or neuromusculoskeletal, as the name implies, we work with nerves, muscles, and bones. It's probably the field that most people are familiar with. We also work with medical and surgical conditions. So if you've had heart or lung conditions, we can help improve quality of life. But we also see patients prior to any surgery, help you better prepare for surgery, and depending, of course, on the nature of your surgery, are involved in your rehab after surgery. Neurology, this is also a massive field on its own. Any insult to the brain or the spinal cord or to the nervous system would fall under this field. Many physios go into this area. Another huge field in physiotherapist is pediatrics, and although in pediatrics we do ortho and heart and lungs as well as the nervous system, it is viewed as a broad field in physiotherapy. Some people prefer working with children and will go into pediatric physiotherapy, whereas others will choose one of those three fields in adults. Career options, there are plenty. You can work literally in any setting, whether it's a healthcare setting, in a school setting, or in a corporate setting. Again, it depends on which area of physiotherapy you develop a passion for. The qualification, in order to become a physiotherapist, you need to enroll at one of 8 universities in South Africa offer the training. It is a 4-year professional degree program. At Stellenbosch University, we take in 55 new graduates every year, so classroom sizes are roughly between 50 and 60 students. And the whole purpose of our curriculum is to graduate you with skills, knowledge, attributes. That's more than just the ability to treat a patient, more than just clinical competence. We also give you entrepreneurial skills, how to set up your own practice, etc. We're very proud to announce a significant renewal in our curriculum. The first year of implementation was last year. And just on this slide, just to give you an idea of what competencies we are talking about that we need to treat. The pink bit speaks to physiotherapy specific, the clinical competence, but if you look at all the other colors on there, there's a significant amount of other skills and competencies that we need to equip you with so that you can function effectively and independently and set up a practice maybe one day after qualification. I mentioned earlier, in South Africa, physiotherapy is regulated by the Health Professions Council of South Africa. We have a board where all physiotherapists who qualify need to register with. They are called the Board for Physiotherapy, Podiatry and Biokinetics. And the responsibility of that board is not just to regulate the profession, but also to set our standards of practice, what the public can expect of us. And of course, as part of that, they set the minimum standards of training. The Health Professions Council, more specifically the board, also come to evaluate our program every 5 years to make sure that we adhere to those commitments. At Stellenbosch University, this is roughly what our curriculum would look like. In the 4 years, we have specific core goals. In year 1, it's to help you better understand the human body and how our systems and structures change over the years. In year 2, we begin to introduce you into all the things that can go wrong with the body. Year 3, we actually start to teach you how to manage all the various conditions, the pathologies. And in year 4, by that stage, you've been exposed to clinical practice, you've got questions of your own, and you tell us what it is that you want to know, and we then make it happen. Another unique aspect of the physiotherapy program at Stellenbosch University is that we expose you to the clinical platform from year 1. So all clinical physiotherapy is a module in all 4 years. And another unique aspect is what we call the being and becoming a physiotherapist, where we focus on all those additional skills, technologies, leadership, behavior modification, etc., etc. Not everything is about study at Stellenbosch University. Our students participate in many extramural activities. Some, of course, not related to physiotherapy, but many related to physiotherapy. And to give you an example, our students participate in many of internationally renowned sporting events, including the Cape Town Cycle Tour, the Two Oceans Marathon, and also the Cape Epic. What do? There? They offer recovery massage services. Another unique element is the strapping competition. So a small group of students with a passion for sports physiotherapy will upskill themselves in strapping and participate in an annual competition that's linked to the Two Oceans Marathon. Very proud also to say that Stellenbosch University has won this competition several times. Some other accolades, and which should attract you to Stellenbosch University. We have in our division Professor Quinette Lowe. She is a distinguished professor and also the first physiotherapist, in fact still the only physiotherapist in South Africa who occupies a Saatchi chair entitled Innovation in Rehabilitation. That of course brings a lot of money for research purposes to Stellenbosch University. A couple of success stories of some of our graduates. You most probably will recognize Aneurin Rebane, now Dr. Rebane. He's the physiotherapist to the Springbok rugby team, was a contributor to the success of our rugby players who won the World Cup in 2023. Next to him, we have Nick Pereira. Nick Pereira has set up a very unique practice that has sparked the interest of the Mail and Guardian, where he in 2022 was acknowledged as one of the top 100 young entrepreneurs in the field of health. And another successful graduate of ours is Karen Fry. She has a roaring, successful practice in South Africa, but is also the physiotherapist to Lloyd Harris, for those of you who are into tennis, and also coordinates all the physiotherapy services for Nedbank Golf in South Africa. The primary purpose of our program is, of course, to ensure successful graduation, hopefully within 4 years, and that you will be one of those smiley faces in the picture. Thank you for listening. I hope to see you soon in the program.